Good evening and welcome to this training session. We are focusing this evening on the perioral area with art filler lips and art filler lips soft. This evening, to show us through this technique and the product, we have Dr. Mihai Gorj with us. Doctor, thank you for being with us.
Hello, Peter, how are you?
I'm very well. This evening, we have the doctor so he can show us the techniques, and it's also a chance for you to ask your questions. So if you have any questions, please feel free to ask them via the live web chat. To start things off, I actually do have a question for you, doctor. We're working on the lips this evening, but what is the role of the lips? Why are they important?
Well, lips are important because we use them for communication, but they're also a key feature of the face. It's something that we use for expressing our beauty, especially for women. So if you change just a little thing, you will change the whole face. So that's very important to know how to enhance them and to make them beautiful.
So you were talking about minor changes there, and I guess that means that we have to be careful of proportions. So with the face and the lips, what are the ideal proportions that we're looking for?
Well, it's important to know that every person is different. For example, in the European type, the lips will be a little bit more backwards in regard to the rickets plane, whereas when you go to African type, the lips will be more projected. And in the other side, another thing that is important is the proportion of the upper lip and the lower lip. And another thing is important, the proportion of the superior part of the lips and the lower part of the lips. And basically, in the European type, what we'll have is that the upper lip will be thinner and the lower lip will be more enhanced, whereas when you'll go to the Chinese, Asian people and to African type, you will have the upper lip taking much more proportion. So what you have is to listen to your patients and give them what they want.
And one of the major effects that influences the proportions is the aging process. But what is the actual impact of the aging process on the lips?
It's a very good question because it makes things a little bit more complicated, With the aging process, you have a loss of volume. That will be something very important. Another point will be that you will have a few perioral wrinkles that will appear and the lips will be thinner. That is exactly what it's regarding the lips, but all the region will change, like the nasolabial folds will take more importance, and when you treat the lips, you have to take in account all this region. So basically, it's not only the lips you're looking at the whole face, and treating the lips will lead you to treat all the face.
Okay, so we've spoken about the proportions and the aging process, but with all of these different things coming into play, how do you choose the right product?
I'm very happy that you asked this question because for a few weeks now, we have a new product created by Filmed, which is the soft lips. This is the new product that is we have on our lip menu. And the difference between the lip soft and the real lips, the ancient lips, is the concentration of the HA, as you can see right now. In fact, what we have is that the concentration of the HA is the same, but basically you have the length of the chain will have less longer chains in the lips soft, and you will have a little bit more of free HA, which will make it easier to inject, and will have not such a big power of volumization. It will enable you to create like softer lips, like velvet, and you can draw it better. And yeah, I think this is a good point because in my practice, in France, the patients ask for really natural results, and I think that the lip soft is the best product to create these natural results. And you will have to choose between a volumizing product to make something more glamorous, and something more natural will go for the lip soft.
Okay, so you've covered a lot of points there, and one thing I gather is that there are many different options out there, but what technique will you be using this evening with our patient?
In fact, an important point is to know that everyone has its own technique of injection. Some would like to use the cannula, some would like to use the needle, and I think there is no right technique. Everyone has its own technique, and when you master it, you can achieve good results for your patients. And one of the techniques that I like if you want to have no bruising and if you want to have natural results, is a technique that I use with a special needle and that you will see tonight. And I hope that you like it, because it's something that I do for a few times now, and it's very nice.
Okay, well, I'll let you get to work. Just as a quick reminder to all of the people watching, if you have any questions, please do send them in, and we'll try and answer them during the session. So, Doctor, it's over to you.
Okay, so our patient today asked me that she wants a very natural result, and she would like to improve her lips. So, what we can see, we'll start with the analysis of her lips. And what we can see, can you just open your mouth a little bit? You see she has a little bit of asymmetry on her lips, because the right side, we'll just mark the median line. This is the median line. And you see the right side of her lip is going a little lower, whereas this part is more enhanced. So there is a little bit of asymmetry on her lower lip. Her upper lip, she has a tattoo that is made, that is going on the white lip, and what she wanted is to enhance the Cupid bow. So what we'll have will help her enhance this Cupid bow, and will also help to enhance the Cupid crests. So that's something that we'll focus on. In her case, you can also see that if we take the plane that we were discussing before, the upper lip is more forward than the lower lip. And this is another point that is very, very important. In fact, this analysis of the face is very good to make every time, because you will notice all these differences between upper and lower lip, between left and right, and it will help you choose the amount of product that you want to put. So in her case, what we'll do is we'll try to enhance the lower lip, give it a little bit more volume, and draw the upper lip. So to do it, we'll use the soft lips, which is the new product that we were discussing. And one thing, yeah.
Sorry, I just have a quick question that we had just sent in. Has the patient already been injected in the lip area?
No, she didn't have any injections at all.
So this is her first time?
Yes, her first lip injection, yeah.
Okay, thank you very much.
And as I was telling you, the thing that I will try to do today is to show you that the presence of the free HA in the lip soft is something very interesting, because it's really soft to inject. And what we'll do is we'll take the lip soft that I have here, if you can see, and I have, as you can see, it's a 33 gauge needle. And it's a special needle, it's a 33 gauge needle with 4 millimeter long, and we'll use it to inject it. And it's, in fact, this technique is kind of a mesotherapy technique. It's a mesotherapy using mesotherapy volumizing technique. So, can you open the mouse? What we'll start to do is we'll start to inject the junction between the dry red lip and the wet red lip. And what we'll want to do is, before we start, we will respect the median region, and we'll inject starting here and vanishing to the lateral side, starting here and vanishing to the lateral side. When you inject the junction between the dry and the wet, like here, so I have my 33 gauge needle going straight deep, and I make a little bolus, as you can see, and the second one. Junction dry and wet. And I follow the junction of the dry and the wet. So I will make a row of injection. Which will enhance the lip. So a little bit of massage. Let's see how it looks. You see the difference already? It's really, really pushed forward. So it's a very good, already a very good result. If you want to enhance it a little more, what you can do is make a second row more outside, so exactly on the dry lip. So we take exactly the same region, we go on the dry lip, and since the needle is really, really thin, it's a 33 gauge needle, you will not have any bruising, you will have very, very little risk, because you will be superficial, it's a only 4 millimeter length needle, and the risk of hematoma is really low. Even if you have a little bit of bleeding, which is normal because you cross the skin barrier, you see you have no bruising. Perfect. I will go to make the other side. Okay. Can you open the mouse? Perfect. And as you can see, I will respect the median region, and I will go on the junction between the dry and the wet lip. And I'm advancing laterally. It's a very safe technique. And what I really like, it makes a very, very soft lips. With very natural results. A little more. Perfect. And just the second row. And that's a way to start, you know. Generally, when I correct the lips, I always prefer doing a little bit of lower correction, not overcorrecting. And I will ask my patients to come back 15 days or 10 days after to make a correction if needed. Perfect.
Excuse me, I just want to interrupt very quickly. We
Yeah.
have 2 questions here. The first one is, what kind of anesthesia or local anesthetic would you use if the patient wants to know?
I have 2 different anesthetic creams. You can use lidocaine 10%. It's something very useful because this lidocaine 10% acts very fast, but it doesn't last very long. And the second one is using prilocaine and lidocaine, and then this will last a little bit longer. So it depends on what you want. You know, if you want it to act strong but not last very long, or if you want a longer time of anesthesia.
Okay, thank you very much. Actually, that question came to us from Anastasia Liana Perugia from Italy, so thank you very much, Anastasia, for that question. The next question is a question from London, from Dr. Zachariah. Thank you very much. This one is about risk areas. Are there any major risk areas that we need to be careful of?
In fact, in the lips, the lip region is quite a risky one. You know, when you use the cannula, basically, you can see on the patient, if we can see it now, you see the corner where the junction, where the lips artery start, is a dangerous area. So if you want to use a cannula or a needle, avoid really the region where the artery belongs. And you know, the arteries are always on the mucosal side. So if you use this technique, it's really safe because the needle is really, really short. It's at only 4 millimeters length. So basically, the risk is really, really low. And if you have an hematoma, it will be only an intramucosal hematoma, which will last like 1 day or 2 days. So it's very easy to inject.
Okay, thank you very much. And just one more question, and then I'll let you let you get back to it. This is from a doctor in Iraq. Thank you very much for that question. And this is, for what purpose do you inject the dry or wet junction, and when do you inject at the dry part?
In fact, when we inject the dry and wet junction, it will make a straight projection. And when you go more outwards, like on the dry lip, you will make it even rounder and rounder and rounder. So it depends on the effect that you want. If you want more volume, or you make it rotate, basically.
Thank you very much. And thank you for those questions. Please keep sending them in. As you can see, we'll be able to answer them throughout the session. I'll let you get back to it.
Perfect. So we'll still need a little bit more on the right side, because on the left side, because the right side was a little bit lower. So now we will get a little bit more outwards, and that you will see that it will make this region go a little bit lower. This is to compensate the difference between the right and the left side. Perfect.
Excuse me, could I just interrupt very quickly?
Yeah.
Yes, I have a question. This is a question all the way from Sweden. Thank you very much. It is, what is the best position for injecting lip filler?
So, I'm right-handed, so I prefer to be on the left of the patient. But I have some colleagues that prefer to be on the right side of the patient. So, in fact, it depends of, I don't know if you know it, if you are, I don't know how you say it in English, it's supinatory or pronatory? No, it's something like this? Yeah, like if you prefer to have the elbow on the outside or on the inside. I prefer the elbow on the inside. So basically I'm more easily on this part, but I can inject both hands so I can be on the other side. But anyway, try to be comfortable. Don't let someone tell you, you have to inject like this, the lips, you know. Feel free to move and to make your own technique. What is important is what you want to do. So as you have seen, we just used a few of the product, and as you can see, the lower lip now is amazing. You can see it on the screen. And all the little wrinkles disappeared. So now we will going to reshape the upper lip. So basically just retain that the lip soft is, due to its very amazing properties, can be injected through a 33 gauge needle, which is really amazing.
Okay, well, I'll let you get back to it. And please keep on sending those questions in. We'll have more later.
So the next step will be drawing the Cupid's bow. This is something very interesting to notice, is that when you inject the Cupid bow, what you want is to make a nice shape of the upper lip. And this nice shape of the upper lip is something that I really like and that patients really ask for it. And what you want to do is, when you inject it, I will show you something really interesting. So you will have to take the point, like this point, here is the point that is at the upper part of the upper lip. And then what you will want to do is to draw the line like here, but what you don't want to go too close to the nose. So basically when you inject it, you will only inject the two lower thirds. So from here to the tip of the Cupid bow. And what we'll do is this. You will pinch the line. You have a little bit of obliquity, you can see it here. And then I enter exactly on the dry red lip, going up to the 2/3. And as you can see, I lift it up to make a negative pressure. So the product will be attracted under the needle, and I inject it while retrotracking. Injecting really softly, you can feel it between your fingers. And when you arrive just here, I like to make a little bolus, so it will help to push the lip a little bit more upwards, as you can see.
Excuse me, I have another question.
She has a little tear.
A little tear. So I do have one question, because we are getting a lot of questions coming in. And this one comes to us all the way from Belgium. So thank you and hello. It is from Dr. Miel. And this question is, can we use the soft filler if the patient has permanent filler already in their lips?
It depends on the fillers that she has. I don't really have the experience. It's a very good question, but I don't have the experience. I think I would try, but warn the patient maybe that you don't have the experience, and let them choose if they want to take the risk or not.
Okay. Thank you very much. And thank you for that question. So we've had questions from many countries so far, from Belgium, from Iraq, from Sweden, all over the world. So keep on sending them in, and we will answer them as soon as we can.
Okay. So we'll do the other side. Exactly the same. So entry. Really soft. Lift up injecting, and just before getting out, a small bolus. That's it. Okay, so now on this side, I'm coming to see how it is. Looks
Doctor,
good.
can I just interrupt you again?
Yes.
I'm sorry I'm interrupting you so much, but we have a question from Qatar, so thank you for sending that in. How much did you inject into the lower lip?
We had like around 0.4 because we had a little play just before the live session, and so we played a little bit with the soft slips, and we injected about 0.4, 0.2 per side, 0.25 per side.
Okay, and the follow-up question is how much will you inject in all, including the upper lip?
I will try to stay in between one syringe, so I will try to stay in 1 ml for one session. I wouldn't like to go very much over. I would prefer to tell the patient to come back and do it a little more. Yeah.
Okay, and we have another final question just on that, is does the patient feel ball-like swelling under the lips or just on the inside of the lips?
In fact, the lip soft has very special properties. It has like really, really lower swelling than all the other products that have been created. As she may see, she will not have a lot of swelling even due to the technique, because injecting with a 33 gauge needle makes it less trauma, so you will have very little swelling.
Okay, and considering that question was from Qatar, we actually have a lot of doctors asking us from Qatar if this product is available in Qatar.
I really don't know it yet. I think so. I think it's available because I've already been to Middle Eastern countries and they start to have it. So basically, if they don't have it, they will have it very soon.
Okay, thank you very much. And one next question from Romania. Thank you for sending that one in. Would you have any risks if you inject perpendicularly into the lip?
No, basically the risk will be still really slow because you have these 4 millimeters of depth. So basically, if you inject it really slow, when you make the trauma, you have the contraction of the artery. So the risk is really low with this technique, yes. And as you can see, I try to be not quite perpendicular, to stay a little bit more superficial. So that's another way of avoiding these risks, yeah. So if you take care, don't be perpendicularly, you can stay a little bit more with an obliquity, yeah.
Okay, thank you very much, and thank you for those questions. I'll be back with a few more in just a few moments.
So another thing that we can do is try to draw a little bit the upper lip. And in order to draw the upper lip, you can have 2 different techniques. One is to do it with a needle, and another one is to do it with a cannula. And I would like to show you that you can also use the cannula to draw the lip. So basically, what we'll use is that we'll use a 30 gauge cannula. And I prefer to use a 30 gauge cannula rather than using the needle, is that you will only make one entry hole, and you'll make a tunnel in the lip, and the product will follow this tunnel. So what we'll have, open a little bit, perfect, chin up, perfect, and I will start at the third of the lip. I won't go too lateral, and I will make an entry point here, very superficial. In fact, what happens here is that the patient had a little bit of numbing cream before, and since we spoke quite a lot, the numbing is getting away a little bit. So I will use the 30 gauge cannula just to draw the lip. I will try to be very superficial. You can see, up. And you can see I'm very, very superficial here, and it's only the way to create this really nice drawing, and I'll inject it retrotracking. Very gentle. Perfect. As you can see, it's really on the upper part. You don't want to inject this lower part, this more lateral part of the upper lip, because you don't want to turn too much this corner of the lip. We'll go on the other side. Un petit peu. C'est super. And as you can see, in the lower lip, where we use the 33 gauge needle, we have no bleeding at all, no swelling at all. The lips are perfect. So that's something very, 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 very nice to have. So here it's like this. Ritual tracking. Perfect. And I press it with my fingers in order to take the shape that I want. Stay really, really on the edge of the lip. Okay? Very nice. And now, yes, the last step is that we'll go back to the 33 gauge needle.
Just before
Yes?
you move on to the next step, I have a question here from Mexico. So good afternoon to everyone over in Mexico. Thank you for joining us. And I would just like to say hello to Emmanuel Denis. Welcome as well. It's a pleasure to have you with us. The question from Mexico, are you injecting 0.5 mils each time?
It depends. Basically, if I use the 33 gauge needle, I know a little bit, I make a pressure in order to see the product. You can see it because it's injected quite superficially. And since it's really soft, it will melt in the lip. So basically I will make 3, 4 or 5 entry points on the edge and with a little bolus on each one. And then I will make a second row of 3 or 4 and then a third row if needed. So I work on rows, you know, the first, I will show you on the patient, look. I will do a first row starting here on the junction, a second row starting here on the junction, and if I need, a third row on the junction.
And each time you're modifying the volumes
Yes,
depending on the area.
I try to adapt it exactly on what the patient wants. And sometimes, but I try to stay in one syringe for a session.
Okay, thank you very much for that answer. And again, thank you for those questions. We will get more later on, so I'll let you get back to it.
So the last step is to give a little bit of volume and a little bit of shape on the upper lip. And what we'll do is that we'll enhance the median region. And exactly like before, we'll stay on the junction, here, just one, a little bolus. On this part, a little bolus. A second here. And one more lateral. We can massage it. You see the needle is so thin that you have no bruising. And the other side exactly the same. 1. 2. And 3. And I will come on this side to massage it and to see the result.
So I'd just like to ask one more question, and this question actually comes to us from Albania. So thank you for joining in, and just as a side note, Albania is actually the 71st country to be joining us this evening. So that's 71 countries around the world. You're absolutely everywhere. Thank you very much for joining us. The question is, do you prefer to use 2 syringes of soft filler instead of 1 syringe of normal art filler lips, as it seems easier to inject?
I would prefer to, yes, it depends. In fact, it depends. I would like to use 1 syringe of the soft filler or 1 syringe of the lip. It depends on what I want. If I want a very big volume, I would use the lips. And if I want a smoother volume, I use the soft fill, so the soft lips. What I will do, if I have to use a second syringe, I will always do it in a second time. Even if it's lips, sometimes you could use 2 syringes, even if it's soft lips, if you use 2 syringes.
Okay, thank you very much. And thank you to Albania for that question. Let's see if we can get to 72 countries by the next time I have a question for you.
In fact, as we can see, she needs a little bit more volume on her left side, just a drop. Just a little bit more on the left side and a little bit more on the lower side, but everything now is already perfect. Okay, so open your mouth, close it. She needs just a little bit of volume to compensate the little asymmetry of the lip. And you see it's really easy to inject with a 33 gauge needle. It's really, really easy. It's amazing to inject it like this, and it's like you can see that in fact since she had the numbing cream like so early, it's like now it's like she had nothing.
Fantastic. I do have a question. This one comes to us from Spain. This question is in relation to the frown lines that you can get around the lip area. Can you use the soft filler lips for that?
Surely. It's in fact what is very good is that the cohesivity of the product and the concentration of DHA is exactly the same on the lips, on the soft lips. It's 25 milligrams. So basically, it still has a good projection power. So you can use it like this. Yes, sure.
Okay, thank you. And thank you for that question from Spain. I'll now move on to a question we have from Italy. So one of our doctors in Italy would like to know if you prefer injecting the lips with the patient lying down or in a seated position.
Depends, both of them. Here it's easier for the camera for sure, for her to being a little bit more on the backwards. She's like, at my place, she's like 45 degrees, yeah, something like this.
So in a half-seated,
Yes.
half-laying position.
Yeah.
Okay, thank you very much for that. And again, thank you for those questions. Keep sending them in.
Thank you. So, regarde un petit peu. Ouvre la bouche. Ferme la bouche. C'est vraiment pas mal. C'est vraiment pas mal. On va en refaire un tout petit peu là. Reviens un tout petit peu à l'extérieur. Just a little. Now I have finished all my planning. I have finished the project that I wanted. Now what I'm doing now is I'm trying to compensate the little asymmetries that she has. So when we started, her lower right side was a little bit lower. So I'm trying to bring it a little bit on this side. Okay. Ouvre un tout petit peu. Ferme un tout petit peu. Ok. Ouvre plus grand. Just a little bit of drop here. What is very good is that you have this no bruising, so that's what's good. So basically we're almost done. We can show her the result a little bit later.
Okay, so thank you very much for that. If you have any last-minute questions, please do feel free to send them in. Doctor, are there any final comments you would like to make about the procedure this evening, about the patient? Any challenges that you found with her, maybe?
Yes, she has a difficult lip injection because she has a little asymmetries, and another challenge is that she has her makeup. She has a permanent makeup of the lips. And this makeup was made just a little bit over the lip. So in fact, what it's important is that you have to compensate the junction. What you have to do is to trust your injection, and because the corrections are not made exactly the same, she will need a little bit more volume on her left side, or just a little bit more on her left side. Sure, it's very good that I can see these images.
And just while you're doing that, I have a question that's come in from Argentina. Thank you for sending that in. And this one is about previous medication. So if the patient has taken any previous medication for things like herpes and mouth herpes.
No, she's not used to having herpes. So when the patients they are not used to having herpes, I don't give them any medications at all.
And is this treatment, can it be used while a patient is taking herpes medication? Or is it not allowed?
If the patients have any herpes, I would tell them just to stop any injection. We would not do any injection if they have the herpes. And if they are intended to, they can have a preventive treatment, yes.
Okay. And we have a question just coming in from England. Thank you very much for sending that in. This question is, how much does this sort of procedure generally cost?
In France, the range is between 350 euros to 600 euros, I think, something like this. It's a wide range, depending on who's injecting on.
And is it usually done in one visit, or do you have to have a follow-up visit a few weeks or months down the track?
As I told you, I always have the follow-up visit, and at my patients, the follow-up is free, And if you have to make a touch-up, it's free. Basically it's in the procedure price. Yeah.
Okay, thank you very much. And we have one more question from Jordan this time, from Dr. Haya, so thank you very much. This question is about the durability. Does this product have the same durability as other products from Filmed?
In fact, the lips soft, the durability will be around a little bit less than 1 year, around 1 year. It will be a little bit longer or around like the universal, something like this.
Okay, well, is there anything else that you need to done? Any final touch-ups that you would like to do?
Maybe a little bit. Here she has a little bit of just a small bruise, really small, very, very little, but not to be seen. She will need a little bit of compensating on this part, just here. And since we will do it, we will be finished. But we can do it on the touch-up, you know. As I told you, I prefer to stop a little bit earlier, under-correct, and have the correction done on the second time, if needed.
If needed, obviously. And we have one question from Tunisia. Thank you to Dr. Linda Saeed. Thank you for sending that question in. So her question is, can we do the upper lips with the cannula?
You can do the upper lip with a cannula, sure, and basically when you have to give a little bit more volume, then you can use the cannula because you want to make a tunnel and to make some space for the product. Then you will use more product to enhance the lip. So I would prefer to use the cannula for the big enhancement of the lips, and I would prefer to use the needle for the touch-ups, for the precision, yeah.
Okay, well, if you're all done, maybe we can have a look to see what it looks like. If you would like to sit upright,
Est-ce que tu peux
please.
t'asseoir un petit peu? Tac. Bien.
So it's looking good.
Looking good. She will have a nice result. Tu peux t'allonger. Super.
So thank you very much for that, Doctor.
Thank you.
And thank you very much to everyone for joining us this evening, or afternoon, or morning, wherever you may be in the world, because we had 72 countries joining us this evening. So thank you very much. Again, thank you to the doctor and to our patient. And we will join you next time on the 25th for the next session. Until then, all the best.
Thank you.